Hello viewers, today we will discuss healthcare and aging. Whatever the circumstances of older people, all are entitled to live in an environment that enhances their capabilities. Today, for the first time in history, most people can expect to live into their 60s and beyond. These changes are dramatic. These extra years of life and demographic shifts have profound implications for each of us, as well as for the societies we live in. They offer unprecedented opportunities and are likely to have a fundamental impact on the way we live our lives, the things we aspire to do, and the ways we relate to each other. Older people contribute to society in many ways, whether it is within their family, to their local community, or to society more broadly. However, the extent of these human and social resources and the opportunities available to each of us as we age will be heavily dependent on one characteristic, our health. If people are experiencing these extra years in good health, their ability to do things they value will have few limits. If these added years are dominated by declines in physical and mental capacities, the implications for older people and for society may be much more negative. The aging of population thus demands a comprehensive public health response. The diagram 1 shows the trends in the number of old people. The yellow color depicts the trends for developed nations and the blue color indicates the trends for developing nations. These are the projections till 2050. The number of old is seen to be increasing rapidly in the developing regions. For the developed nations, the share is proportionally smaller, though the numbers are increasing there as well. The table 1 shows the changing patterns of old population aged 60 years across the years given. An increasing percentage would be an addition to the old dependents. For the world, this proportion has risen from 8.1 to 10 between 1950–2000. For the less developed regions, it increased from 6.4 to 7.7 during the same period. For the least developed regions, this percentage declined from 5.4 to 4.9 across the two time periods. For Africa, this percentage is consistent, and for Asia and Latin America and Caribbean, it has increased. Aging and global trends. Population aging refers to shifts in the age distribution of the population in which the relative share of persons at older age increases and the share at younger age decreases. This proportional redistribution is distinct from absolute increase in the number of older persons that can occur even if their share does not increase. These changes that constitute and influence aging are complex. At the biological level, aging is associated with the gradual accumulation of a wide variety of molecular and cellular damage. Over time, this damage leads to a gradual decrease in the physiological reserves, an increased risk of many diseases, and a general decline in the capacity of the individual. Ultimately, it will result into death. Beyond these biological losses, older age frequently involves other significant changes. These include the shifts in roles and social positions and the need to deal with the loss of close relationships. In developing a public health response to aging, it is thus important not just to consider approaches that ameliorate the losses associated with older age, but also those that reinforce recovery, adaptation, and psychological growth. The global population is on the brink of a remarkable transformation because of the aging of today's middle-age demographic bulge and ongoing improvements in life expectancy. The population of seniors is projected to surge, increasing from 530.5 million in 2010 to 1.5 billion in 2050. The population of children, meanwhile, will be at a virtual standstill due to long-term declines in birth rates around the world. The number of children younger than 15 is expected to increase by only 10% from 1.8 billion in 2010 to 2 billion in 2050. Consequently, the global share of the population that is 65 and older will double from 8% in 2010 to 16% in 2050. The two important drivers of this transformation are a reduction in the fertility rate and increase in life expectancy. Between 1950 and 2005, global fertility per woman nearly halved, reaching 2.6 children. Around 2018, those aged over 65 will outnumber those under 5 for the first time. In many countries, the fastest growing demographic group is over 80s and 85s, often termed as the oldest old. The table 2 shows the patterns of change in the median age in different regions of the world during 3 time periods. For the world, the median age has increased from 23.5 years to 29.2 between 1950 to 2013. For the more developed regions also, there has been substantial increases in the median age from 28.5 to 40.5 years. Same is the case for the less developed regions where the median age has increased from 21.4 years to 27.2 years. The diagram 2 shows the young children and old as percentage of global population. The red line shows falling trend for the under 5 population as a possible scenario in 2050. However, the rising blue line shows the old population is likely to be a greater proportion of total population in 2050. Aging in the developed and developing countries. In the less developed regions, the population aged 60 or over increased at the rate of 3.7% annually in the period 2010 to 2015 and projected to increase by 2.9% annually before 2050 and 0.9% annually between 2050 and 2100. Its numbers is expected to rise from 554 million in 2013 to 1.6 billion in 2050. By 2050, the proportion of older persons is projected to reach 19%. After 2050, population aging in the less developed regions will continue but at a slower pace. It is also expected that there will be a rapid increase in the persons aged 80 years or over from 63 million in 2013 to 268 million in 2050. The old age dependency burden started to increase from mid-90s onwards from Latin America, Caribbean and Asia. In 2050, 89 countries are projected to have a median age above 40 years and almost half of them will be from less developed regions. By 2050, 79% of the world's oldest persons will live in less developed regions. The major change anticipated for the more developed regions is the transfer of population from working ages to 65 and over. The old age dependency ratio will almost double, increasing from 22.6 persons aged 65 and over per 100 persons of working age in 2005 to an expected value of 44.4 in 2050. In 1950, the median age of the more developed nations was only 29 years, but it is projected to increase more than 45 years by 2050. Europe, which had already reached a median age of 39 years in 2005, is expected to increase to 47.1 years in 2050. The table 3 shows distribution of population across 3 age groups 0 to 14, 15 to 59 and 60 plus years. Globally, the percentage of population in 60 plus groups is projected to be 21% in 2050. For the more developed regions and less developed regions, this percentage is projected to be 33.5 and 19.3 respectively. In the age group 15 to 59, the percentage is projected to increase globally and also for less developed regions, but projected to decline for more developed regions. International legal and policy frameworks advancing health into aging. 2 international policy instruments have guided action on aging since 2002. The Madrid International Plan of Action on Aging and the World Health Organization Active Aging, a policy framework. Each document identifies the importance of health in older age. International Human Rights Law. As per this law, human rights apply to all people, including older people, even when there is no specific reference in the text to older age groups or aging. During the past 2 decades, major studies have been made in efforts to advance human rights, including those of older people. The Madrid International Plan of Action on Aging. In 2002, the United Nations General Assembly endorsed the Political Declaration and Madrid International Plan of Action of Aging. 3 priorities of action were identified in their recommendations: older persons and development, advancing health and well-being into old age, ensuring that older people benefit from enabling and supportive environments. Active aging. The idea of active aging emerged as an attempt to bring together strongly compartmentalized policy domains in a coherent way. In 2002, the World Health Organization released Active Aging, a policy framework. This framework defined active aging as the process of optimizing opportunities for health, participation and security to enhance quality of life as people age. It emphasizes the need for action across multiple sectors and has the goal of ensuring that older persons remain a resource to their families, communities and economies. The WHO policy framework identifies 6 key determinants of active aging: economic, behavioral, personal, social, health and social services and the physical environment. The diagram 3 shows the active aging framework conceived by World Health Organization. Active aging depends on social factors as well as physical and personal determinants. The diagram 4 shows the 3 pillars of active aging that include participation, health and security. Importance of acting on aging and health. Here it is necessary to discuss as to why health is an important agenda, especially for older people. There are many justifications for devoting public resources to improving the health of older populations. The rights of older people. A human right-based approach to health states that the right to health embraces a wide range of socioeconomic factors that promote conditions in which people can lead a healthy life. A wide range of laws, policies, and actions is therefore required to help create the appropriate conditions to ensure that older people can enjoy the highest attainable standard of health. Aging, health, and development. The second key justification for taking action on aging and health is to foster sustainable development. If we are to build societies that are cohesive, peaceful, equitable, and secure, development will need to take account of this demographic transition and to harness the contributions that older people make to development and ensure that they are not left behind. The economic imperative. A third reason for taking action is the economic imperative to adapt to the shifts in the age structure in ways that minimize the expenditures associated with population aging while maximizing the many contributions that older people make. These contributions may be made by direct participation in formal and informal workspace, through taxes and consumption, through transfers of cash and property to younger generations, and through a myriad of less tangible benefits that accrue to their families and communities. Key challenges for healthcare. Developed and less developed countries are confronted with a number of similar challenges regarding healthcare. Significant pressure on pay-as-you-go healthcare systems. This is because of the rapid population aging and expensive medical technologies and higher incidences of chronic diseases. Growing expectations that private sector will come to rescue. As governments continue to struggle with rising pension and healthcare costs, further political reforms and a growing role of private sector are likely to emerge. Pressure on employers to fund employees will increase. Lack of individual financial knowledge as a major policy concern. A better understanding of savings and investment alternatives has become increasingly important due to the shifts towards greater individual responsibility and personal choices in defined contribution retirement schemes, especially in developed countries. The growing prevalence of chronic diseases around the world. According to WHO 2006, cardiovascular diseases, mainly heart disease and stroke, are the leading causes of 30% of deaths in the world. The WHO expects deaths from cardiovascular disease will increase by 17% between 2005 and 2015. Most less developed nations confront the following challenges. Unfulfilled existing health systems. In less developed countries, particularly the low-income nations, current health systems are still mainly oriented towards providing care for acute episodic conditions and are not geared towards chronic care needs and care that is specific to older needs. The lack of formal social security coverage. According to UN 2007, on average, only 20% of populations in less developed countries are covered by social security benefits. Underdeveloped private pension and health insurance markets. Pension markets are not much developed, and so is the case with health insurance markets. The double burden of infectious and chronic diseases. Many less developed countries have not yet adequately addressed public health goals such as mass vaccination. At the same time, they are confronted with rapid population aging, which is leading to greater demands for healthcare services by older people with chronic diseases. In addition, infectious diseases are now spreading geographically much faster than any time in history. The structural shortage of well-trained healthcare workers. According to WHO 2006, a global deficit of 2.4 million doctors, nurses, midwives exists. These nations as it is face shortage of healthcare workers. Old age care is especially in need of more personnel. The diminishing role of family in old age security. In many less developed countries and in some developed countries, families traditionally have played an important role in supporting aging populations. As per this, parents can rely on the financial support of their children. This tradition is codified in law in some countries also. However, this social convention is being challenged as many young people migrate to cities, family sizes shrink, and people adopt more individualistic attitudes. How can health systems for elderly be improved? The following are the most important components of caring for the old. Age well and stay well. This means that older people should be able to enjoy long and healthy lives, feeling safe at home and connected to their community. Live well with one or more long-term conditions. Older people with simple or stable long-term conditions should be enabled to live well, avoiding unnecessary complications and acute crises. Support for the complex morbidities, frailty. Health and care services should support older people with complex multiple comorbidities, including frailty and dementia, to remain as well and independent as possible and to avoid deterioration or complications. Accessible, effective support in crisis. When the health or independence of older people rapidly deteriorates, they should have rapid access to urgent care, including effective alternatives to hospital. They should be able to avail health services close to home in times of crisis. High quality person-centered acute care. Acute hospital care must meet the needs of older patients with complex comorbidities, frailty and dementia. Services should provide adequate access to specialist input, minimize harms and ward moves, and provide care that is compassionate and person-centric. Good discharge planning and post-discharge support. Discharge planning needs to start at first contact with hospital and be standardized and embedded in practice with older people and their caretakers. It is important to ensure that patients can leave the hospital once their clinical treatment is complete with good post-discharge support to reduce the chances of further emergency readmissions. Effective rehabilitation. Older people must receive adequate rehabilitation when needed to prevent permanent disability, greater reliance on care and support, avoidable admissions to hospitals, and to provide adequate periods of assessment and recovery before any decision is made to move into long-term care. Person-centered dignified long-term care. Though some people make a positive choice to enter long-term care, older people should only generally move into nursing and residential care when the other alternatives are exhausted. Residents should consistently receive high quality care that is person-centric and dignified. Support, control and choice at end of life. Older people who are nearing the end of life should receive timely help if they want or need it to discuss and plan for the end of life. End of life care services should provide high quality care, support choice and control, and should avoid over medicalizing what is a natural phase of aging life course. The diagram 5 shows the various methods that can be adopted to improve health care for the old, such as health resource planning, payment reform, health insurance innovation. The above diagram 6 describes the 10 very important components of healthcare for the elderly. These have been shown in circles. It is important to age well, live well with long-term conditions, providing support for complex morbidities, accessible support, personal care, as well as good discharge planning. Conclusion. Timely and appropriate action can transform the challenge of aging societies into an opportunity to stimulate economic growth and improve well-being. There is a collective opportunity to turn a greying society into a silver society, a society in which the elderly are valued, healthy and active. The private sector can benefit by catering to the unmet needs of the current and future elderly, and the governments can still facilitate old age security for citizens while overcoming financial pressures on public pensioners and healthcare systems. With this, we come to the end of today's lecture. In the next session, I shall talk about another related topic. Goodbye. Thank you very much.